patients are obsessed with the neck. Not a day goes by, somebody's asking me, what can I do about my neck? It doesn't look good in this picture. So there's non-surgical, surgical. We need to break that down. Sean, what do you think?
So I completely agree with you. Young, old, men, women are talking to me about the neck every day. Everyone's concerned with it. And I think it's actually because we see our neck on photos and on phones so much more. The non-surgical approach to necks is important. I think we need to talk about it. I think removing some fat with Kybella or liposuction is a really good option for people with low downtime and a nice subtle effect.
And you can actually dissolve the fat with that.
Yep. So, Kybella permanently gets rid of the treated fat.
Mike, what do you think? Surgical, non-surgical? What's your approach?
Well, I think it depends, right? The neck, we've got skin, we've got fat, and then we have muscle underneath the fat. So it really depends on what the problem is. In a number of patients, it's all three. So you'd like to correct all three, and that's hard to do non-surgical. If it's just fat and in the younger patient,
right,
I think there are some really good non-surgical options. Cool sculpting is a possibility, and then in-clinic lipo for a small amount is another good option.
I also think men do very well with non-invasive treatments here, so specifically Kybella, to melt that fat.
People talk about, I got this turkey gobbler. What is that? What is that?
So usually that's a lot of extra skin, right? And as we age our skin, we lose elasticity. So then gravity, it rules the solar system. Obviously it can control our necks, and skin starts to sag, and that needs to be tightened up. There's no great skin tightening options, in my opinion, for the neck beyond surgery. Nothing that can take the place of surgery.
I do think, though, some of these non-surgical treatments can approach a surgical result, and if a patient understands that they're not going to get a surgical treatment,
right,
which I agree with you is the gold standard for treatment of a turkey neck, but if they can't afford it, they can't have the downtime, or medically it's not appropriate for them, non-invasive treatments to stimulate the skin to improve a little bit of elasticity, even a 30% improvement, I think is worth it, and some of my patients really appreciate that.
Yeah, and I think you're exactly right, Sean. It's all about patient selection, and they just have to be educated on the limitations of that.
Right.
If for a lot of reasons patients aren't candidates for surgery or don't want to go through it.
It's not like it's months of recovery for this.
No, it's not. Now, it depends, because if you fix the neck, which is usually associated with signs of aging, now all of a sudden you might be focused on the eyes, or you may be focused on the jowl or the middle of the face. So it all starts with that education, and then
Absolutely.
a good discussion about what the best way to proceed forward is.
And if you're obsessed about your neck, you can find more information on this on theplasticsurgerychannel.com.